everybody. And the volume is working this time. I'm Alice Bell. I'm Head of Policy for the Climate and Health Programme at the Wellcome Trust, and it's my job to welcome you here to this session on Thinking Differently, Doing Differently, Climate and Health Research Agenda that meets the challenges of climate change. Climate crisis is something that demands change. Change is coming. It is coming from the skies and the seas, or it's coming from us. Probably in a situation by 2024 that there's a bit of both. So it's up to us to think about what change. What change do we want to control? What other things do we want to change with the changes that we're making for climate change? What other things are broken that we can fix or tackle with the challenge of the climate crisis? Who is going to be driving that change? How can we ensure that we change the right things and don't cause changes that are going to cause more problems? So to start to think about the things that we need to change and how we can do change differently, the different ways that it invites us to think about climate research, health research, science, the world. We have a great panel. We have a good geographical spread, I think, and we have, I'm really sorry, not got great gender diversity. But we'll take any comments on that to go. We've got a great panel. I'm just going to introduce them briefly, and then I'll do a full bio with each of them as they have some remarks. They've got some prepared thoughts for us to get us going. Then I'm going to ask them to respond to each other if they've got any questions for each other. And then we've also got Slido questions that you can submit, just as we've done before. We're running a bit late, but we've still got our full hour. I think we've caught up a little bit from lunch, so let's see if we can get going. We have Adelheid Onyango from WHO Africa. We have Carol Zavaleta from the Indigenous Peoples Observatory Network. We have Judy Omumbo from Science for Africa Foundation, and Carmen Laplaza Santos from right here in Brussels, DG Research and Innovation. And first of all, I wanted to turn to Adelheid, who is Director of the Universal Health Coverage Healthier Populations Cluster at the WHO Regional Office for Africa. She provides strategic leadership for WHO's work with governments, development partners, civil society groups and communities to promote population health and well-being. She oversees programs that work across government sectors in addressing the social, environment and economic determinants of health, reducing health risks and creating healthier life settings. So as you can imagine, she was a perfect person for us to ask to speak to this. And I wanted just to kick us off, if you could say something on how global health policies are shaped currently and the challenges when it comes to bridging sectors to address the some of those complex intersections of climate and health.
Yeah, hi. Thank you, everybody, and thank you very much for the invitation to speak here today. As others have said it before, the WHO sits at the intersection between research and policy. So we work with scientists to bring together the evidence to inform answers to the public health challenges that we see. And we present those to the policymakers in the name of the member states who come together in our governing bodies. And that is how global policies are shaped. Or regional policies when we bring together our regional committees of the health ministers. Now, when it's a question of, let's say, viruses that are causing diseases, the science is quite straightforward. You know, this virus is what's responsible for this disease, and therefore what policies do we put in place in order for us to address the challenges that are arising from that. But when it's a question of issues that are contributed to by human actions and lifestyles and the choices, then the house is divided on how that policy is shaped. Because then we begin to say, well, somebody is responsible and somebody needs to take responsibility for that. And we begin to move into a space that is very complex. It's very complex because we're talking about, yes, the issues are coming from different sectors. It's not just the health sector that needs to deal with them or that is creating them. And so we usually we meet in forums like this, as we've seen earlier today, where it's mostly health people. And so sometimes we are blind spotted on what other sectors need to be doing and what we should be doing with them in order for those policies to address the challenges comprehensively. And then you have the differences in where we are sitting, how we're being impacted by those problems. So geopolitics comes into play. In fact, the climate change discussion is one area where, yes, we have acknowledged that it's one of the biggest threats to health, But when we begin to talk about how we address that, the policy dialogue is not easy because we are talking about thorny issues like common but differentiated responsibilities, because people are pointing fingers, one direction, the other direction. We're saying we all need to act, but we have not agreed on what we need to act, what responsibilities, and who pays for those actions that we need to take. So we are in a space that is right now, we understand that there's a huge problem that we need to address, but I think we need to step away from the politics of who gains from what and begin perhaps to go to more neutral spaces. Maybe the scientists can help us to do that. But before I go into that discussion where who asks what questions, we need to perhaps hope that scientists can step away from the political policy-making processes and look at what people are experiencing. And I think what has been mentioned here about why we need to speak with the people who are experiencing the impacts of climate change before, as we design the answers to those problems, I think it's very important that that happens, and it happens with a very sensitive and conscious appreciation of there are human beings suffering, and we need to alleviate that suffering.
Thank you. We heard a lot earlier about involving different communities in research, and lots of people stood up in the plenary saying that they agreed with these statements, but we didn't really get into the how and some of the complexities of it. But maybe as we go forward, we'll be able to pull some of that out. And so perhaps partly on that theme, I want to introduce more fully Dr. Carol Zavaleta, who's a medical doctor, Quechua Indigenous doctoral researcher, and specialist in topics related to climate change, intercultural health, food security, and Indigenous health. She's extensive experience in the development and management of scientific research, particularly in health programs for Indigenous communities in the Peruvian Amazon. And she's also a Wellcome Trust International Training Fellow, but we won't hold you, your terrible funder against you. And could you tell us something a bit more about IPON and how you think we can promote the participation of typically absent or neglected populations when we're discussing climate and health intersection?
Thank you, Alice. Can you hear me? Yes, right? Yeah. Okay, thank you. Thank you. First, thank you, everyone, and thank you to Brussels to bring me to here to stay with you and share this information that I want to tell you. And so it's I am from a province in my country that is called Ancash. And first, please allow me to ask you a question, because in my interactions with researchers at international level, I come out with be more conscious about the connections between science and Indigenous people. And the question is, just could you please put your hand up if you have been in contact with an Indigenous person in the past? Excellent. Thank you so much. Thank you for sharing this. This is very, very important to give me an idea about how we are in this session, and also because I didn't realize that I was living with Indigenous people even in my own family when I was studying medicine. So I come out that in my country, the 25% of the population recognized as Indigenous people, maybe 5 years after I finished my career. And also in Bolivia, where I am living now, is 60% of population. In Mexico, it's around 40% of population who self-identify as Indigenous people. Here in Europe, you also have Indigenous people, probably more in the north. That's what I know, right? And so I wanted to share first what IPON is, and I wrote this, and I want to read it to you because I don't want to miss anyone here. So the Indigenous People Observatory Network was born during the pandemic, when a group of researchers working with remote Indigenous communities got seriously worried about the potential implications of COVID for Indigenous people's lives. During the early stage of the pandemic, I became increasingly frustrated with the absence of data about the impact of COVID-19 in Indigenous people. And I was wondering why there was not information about Indigenous people, and more importantly, specific actions to help them. If they inhabit all continents of the planet, typically experience poor health indicators compared with non-indigenous people, had poor access to quality health services, and there was evidence that previous pandemics had hit them badly. To decrease my frustration, I prepared a commentary and sent it rapidly without hesitation to one prestigious science journal, with honestly very little hope that they can publish, but they did it. Just 1 month after, in April 2020, they did it, and after that in my country, they got more attention about what is happening in the indigenous people in my country. Later, my Peruvian mentor could tell me that really, when we wrote these types of comments, it means that we have something to say to the world. At the end of the same year, in 2020, my colleagues from Canada, the UK, Uganda, Namibia, India, Ghana, Sri Lanka, South Africa, and Fiji, we got a grant from the government of the UK to implement the COVID-19 observatories for indigenous peoples. So we worked virtually for 2 years with indigenous community members and leaders to create a system that collects data longitudinally of the lived experience of people on the ground and collect evidence not only about how they were impacted, but more importantly, how they respond to the pandemic shock. We also were collecting data about what type of extreme events were affecting at the same time that the COVID-19 pandemic. So once the pandemic ended, we decided to stay together to create the IPON, to work with the same approach and similar methodology to understand and respond to climatic hazards. So currently, IPON is composed of researchers from 13 countries, mostly based in the Global South. Some of us, including myself, acknowledge that our indigenous families gave us the love, strength, and courage to complete our scientific training. So to answer the question that Alice proposed to me, I was thinking that we have at least 3 ideas. One is to work with indigenous researchers who are on the ground. There are many indigenous researchers, but not necessarily they're recognized as indigenous, even when their family, they gave us indigenous knowledge. The second thing is support the next generation of indigenous scientists. I think this is very important because we are also talking here about the youth. How is the role of youth in these discussions about climate change and health? And I think there are many indigenous youth who can be also scientists and who could be researchers and contribute with the investigation of climate change and research. And also what is very important is to generate this data at country and global level about indigenous people in the health systems. So there are some countries, like in Peru, for example, that we have policy and intercultural policy, where we actually recognize indigenous people, but the collection of data is still a situation, is complicated to ask the people which ethnicity they self-identify. So if you are doing research, you can also contribute with this, just adding one question and ask how they self-identify in terms of ethnicity. So this is ideas that I have. Thank you, Alice.
Thank you. And we moved from WH Afro to Peru, and now we're going to move back to Africa with the Science for Africa Foundation and Judy Omumbo. Judy is an accomplished climate change and global health expert, which makes her a rare and special person, as she has knowledge in that intersection, although I hope we can see we're growing more and more of those right now. She is head of programs at the Science for Africa Foundation, managing bespoke programs addressing emerging challenges that can be addressed through science and innovation, and support African scientists to develop leadership of the continent's research agenda. Judy also fosters partnerships within the research ecosystem, which entails generating innovative scientific ideas that address Africa's most pressing developmental needs, while championing the Foundation's efforts from funding from early discovery centres to translation sciences. In her various capacities, she's advised on the research and policy dialogue on climate change, adaptation and resilience. She's a member of the WMO Research Board, the Adaptation Research Alliance Steering Board, and a past co-chair of the WMO COVID Task Force on Air Quality and Meteorological Factors in COVID-19 Transmission. So, Judy, as an advocate for the critical role of science and innovation in shaping interventions in climate and health, what are your thoughts on the sorts of priorities for research to support policymaking that meets the needs of the most vulnerable when it comes to climate and health?
That's a really long question. Well, thank you for that, Alice. We're thinking differently and we're doing differently in this session. So I'd like to, draw our attention back to a map that was projected by Alan Danga. And Alan, if you're in here, apologies for stealing a page from your book, but it's a nice way of summarizing what I want to talk about. I'm really obsessed with maps. They tell you a lot. But over and over the years, 'cause I've done a lot of work with mapping, risk of disease and so on and so forth, and where are all the Africans, those sorts of things, because they're always important in these policy diagrams, particularly where the Africans are. So looking at that map, I become obsessed with the gaps, and looking at, we must investigate why are there those gaps? Because you'll see a similar map when you're looking at economic development, where money is, where funding goes to, where knowledge is available. And really bizarrely, those gaps are where all the people are. They're also the spaces where all the resources are. So there's something that is still not happening. It's been the same map forever and ever since I started mapping, and that's about 30 years ago. We need to do something about that, really investigate, go into those spaces and find out why is it that we're not getting information on who's doing researches in those areas. So there are just a few things that I feel that we need to discuss and bring along in the area of research. First of all, we talk a lot about prioritization. And again, the gap is there. The same white areas that we saw on the map are the areas where the priorities don't seem to come from. And yet all the people who need to be prioritized upon come from there. Why is that a problem? Why does it happen that way? So when we continue speaking about how we need to surface research priorities, sometimes it helps to just go there and find out what are those research priorities. The fact that there's a gap doesn't mean to say that there's nothing going on there. Or is that the feeling? Sometimes when we look at gaps, and this is what gaps do to us on maps, we think that there's nothing happening. But there are things happening. Communities in those low and middle income countries are actually adapting and have been adapting for years to changes in temperature, to heat. Recently, I was up in northern Kenya, an area called Turkana. It was 48 to 50 degrees the whole time. And people were collecting water. Their children were walking to school very happily. They were eating. So there's a lot of lessons that we can still learn just by making an effort to go and find the priorities at the places where they're most important. The other thing is around building leadership. Leadership in research. I've been to a lot of global meetings, and we stood up this morning and how many people from Africa. And then I stood around and looked around and saw my sister and one other person over here. This is an important meeting. There needs to be efforts to make sure that it's representative of the questions that are being addressed in this meeting. We are there, we are research scientists working in Africa to be over here. Or even the fact that the climate scientists are not here needs to be addressed deliberately. The other thing is around prioritization. The other thing I want to say about leadership is even on most global discussions, when decisions are made, from the United Nations General Assembly decisions, there are no Africans in that decision space. I've been to COPs, many COPs for many years. When the roundtable discussions happen, the doors close, and who gets left outside or sitting at the back? Okay, so really investing in the research arena, in building leadership amongst those who are most impacted and most vulnerable to the issues that are being addressed in that meeting. And the final one that I'd like to say something about is equity in partnerships. We've always worried about the fact that how the funding, the actual funding and its source of funding and priorities from funders tend to drive research agendas because we respond to calls. I know that there's been a massive change, and I think even with our partners in our organization, partners coming in and asking us, what do we think? But there's a lot of discussion at the ideation space, but a lack of co-creation as we go along. I mean, we can have a discussion, and then the next thing you do is you see a call. And then we apply for that call, and we compete with each other on the continent to create more gaps by competing with each other in response to that call. I think we need to really look at investigating equity in partnerships in detail and deliberately, and really with an intention to change something about that as well. So there are a lot of things where we always want to say, look, this is the priority. Should we do this research? Is it environment? Is it health? Climate change affects everything. Climate change affects everything. And I think we need to be able to support research so that it can be creative. I think in our organization, this is not a platform for me to be talking about my organization really. What we have realized is that we don't have to tell researchers what to do because they identify the problems. They work with communities that maybe they come from, they've had experience with, and then we allow them to be creative in designing what they would say is the right study. And I think that is a good way to begin. Ask the people who are most impacted to say what they want to do and support them to answer their questions. Support them in being creative. Allow them even to fail, as sometimes discovery might fail. Allow them even to fail and continue to support them and to provide funding that is sustainable in the long term. Nobody can learn anything about anything in 6 months or in a year, or perhaps even in 2 years. Sustained funding into an ecosystem that encourages discovery, that encourages priority setting, that encourages transdisciplinary work, that encourages prioritizing challenges that have been identified at the level where the challenges are experienced.
Thank you. And finally, back to Brussels. We have Carmen Laplaza Santos, who's head of the Health Innovations and Ecosystems Unit within the DG for Research and Innovation. Prior to that, she was deputy head of the Innovative and Personalised Medicine Unit. She's also worked for DG for Communications Networks, Content and Technology, where she was deputy head of e-health, wellbeing and ageing unit. She's an economist by training and has held senior roles in financial and strategic departments of different sectors before joining the EC in 2008. And so we've had, because we're here in Brussels, we've heard quite a lot about EC policy landscape in the last 24 hours. But how can EU-funded research support evidence-based policies on climate change and health here, but everywhere? Another question for you as someone who works in policy: how can your funded research help inform the research agenda, the policy agenda?
Thank you, Alice. So first of all, I think that we have a good basis in order to contribute from our research efforts in order to bring solutions. Let me maybe start by praising the collaborative nature of our program. I think we are the bigger funder of collaborative research in the world, and that's a particular feature when it comes to find solutions for this such broad and complex challenge. So I think this collaborative aspect is one of our maybe key assets. We have had a lot of experience on that, and I think it will be crucial. Also, the way we are thinking and preparing our topics to be launched for research, we are increasingly co-creating with internal and external actors in order to ensure that we are going to deliver a research that will answer, for example, regulatory needs. It's an example. There are many needs, but we really have that in consideration when we draft our topics for funding. Also, we are increasingly, and particularly in the field of environmental health, pushing our projects for policy feedback. So we heard a lot talking yesterday about the importance of having policy literate scientists, and that's something that is critical for us, and we are pushing a lot in order to ensure this dialogue, right? And also we have already instruments that we can use in order to provide solutions. So let me mention, for example, our partnerships with member states. We can think about the human biomonitoring that deliver a lot of important results that have already been uptaken in some, for example, revisions of directives, or the partnership around the assessment of risk for chemicals. We have also partnership with other actors like the private industry. We heard quite a lot in different sessions talking about the Innovative Health Initiative. We also heard talking about the EDCTP3. So I think we have a good basis. However, it is clear that we can do more and we can do better. We can and we have to. So we can do better because we have here how much there is an issue in the knowledge translation process. This is something that we need to tackle. We have to push, as some of the speakers were already saying before, to ensure that we are not just going to publish papers, but that we are going to go quicker for action. Also, we need data. I'm sorry, but I also want to talk about this brilliant map of Alan, because I think he was not the only one talking about the need of data, but it has been raised by some others, but I think it's crucial. We cannot advance a lot of research if data is not available. Health data, climate data, I think that's something where we, as funders, need to do better. Also, there are some dimensions that we also need to foster research around it. One clear example for me is behavioral change pathways. We need to understand how can we influence them. So, and also we can do more. And in this area, it's going to be particularly complicated because we are talking about a huge challenge, but also of very broad scope. The nature is very different. So we are not going to have one solution fits all. We are going to have to be creative, to look outside of the box and see what are the best instruments for each of the sub-challenges that we are mentioning. Call it mental health, call it empowerment, call it individual responsibility, call it education, call it many things. The good news is that we want to do more and we want to do better, and I think that the different interventions of representatives of the European Commission have shown the political commitment. So from our side, we decided to organize this conference because we really want to build an impactful research and innovation agenda that will guide our work in the future framework programs, but that can also be used by other funders from other different geographical regions and research contexts. And that's why it's very important for us to hear from you all, not only today, but in the process that we will start from now. I think we have much to win and to learn from this dialogue. At least I am much more aware now. I think I knew already, but now I'm really aware of how there are other parts of the world where a lot of people have a lot of experience and knowledge on how to adapt, because they are already doing since long. So it is crucial to build on that experience. So what we want to do is to really integrate the priorities, the feedback, the aspects that different actors consider important. They can be the researchers, other funders, policymakers, the industry, NGOs, and also all those populations that are usually not considered in this kind of exercise. And in one of the slides we saw this morning, we saw that these populations are quite important and numerous in size. If you think of the addition of all vulnerable populations, people who suffer already of different things, the child, the older, the indigenous population, that makes a lot of people, so they can certainly not be excluded, certainly not anymore. So I think we will try to be as inclusive as possible. And when I see all the discussions, all the interest that this conference has raised, I really have hope that we will, in any case, we are already starting this process with a lot of input, a lot of material, a lot of contributions from all the brilliant speakers, but also for many conversations that have been taking place during these 2 days. So thanks from my side, and just to close my intervention, I will say that we have to be optimistic.
Thank you. That was a really good starting point. We've had about half of our sessions listening to our great speakers, and we can move on to the second half where we can have a bit more of a conversation. It was really great to hear from all four of you. As someone who works in, someone who moved from sort of straightforward climate policy to working for a science funder, a lot of people ask me, and I try and explain to my climate action friends why I moved back to work to science and working for somewhere like Wellcome. And I say, science justice is a route to climate justice. If you can fix the things that are wrong with science, it will help you tackle the climate problem in a more just and equitable way. And I think we heard a lot from you as one of the dynamics of someone who works in between science and policy for too many years, is that we often hear that policy gets it wrong. You know, science is this perfect thing that it presents to policy, and these horrible policy people don't listen. And sometimes we you sort of go, oh, well, maybe we need to do our comms a bit better. We need to clean it up so it looks nice. So we give it to these shallow policy people. But actually, not just with that there is some truth in that, a bit of the dynamic. But also, we need to look at ourselves. Sometimes it is something wrong with science itself as well. And that if we can make science better, we will have better policy solutions, and we'll have better and stronger, fairer policy impact. So just we can have some. We've got a few questions coming in the Slido. I'd really invite the audience to bring in some more, to get thinking about the things you want to prompt us, our speakers, to think more about. But just to ask you to talk to each other, and if you had any comments or questions for each other, to get going.
I just wanted to say that I think I'm confident that the map will change in the next 30 years. I hope that if we meet again in 30 years, this map that has struck us, both of us, has changed. That's my hope.
And I hope someone is taking minutes, because we shall return in 30 years.
Could we, I mean, we're talking about how the climate crisis is asking us to think differently and do differently. Could we speed that timeline up a bit from 30 years, considering we have a climate crisis?
No.
No? Okay.
That's too long to wait.
Yeah.
No, that's too long to wait. We're talking about people who are suffering today, so we need to take action today. And so that's why it's very important that we're thinking about what's already happening. I mean, I think the Wellcome Trust and all the efforts that are going on right now to set up those networks, to work with institutions in the Global South, to improve research capacity, to create the networks among them, because sometimes there is more we achieve also when we are speaking among equals than when there is that, we were talking about the equity in power. You know, you have the institutions that are more established, and they tend to have the upper hand in that relationship. But I think when we put together institutions that are on the same level of learning, then there's a certain confidence in stepping forward and saying, I don't know this part, and therefore the learning is different, the dynamic is different. And it's also there that we can get closer to the communities that have been mostly left out, but who have a lot of knowledge, that indigenous knowledge. Yesterday, Marina Romanello was talking about doing science differently, asking questions and doing research differently, because we have a lot of confidence in randomized controlled trials, in very systematically organized research, longitudinal studies and cohorts. But there's a lot that we can learn also from the undocumented practices that indigenous communities that lived in marginal geographic ecological zones, and somehow, like Judy was talking about, they have been adapting and mitigating climate changes. And they've lived well for a long time. Of course, something happened and lifestyles changed, and we are seeing differences to that. But there is knowledge that can be harnessed if we ask the right questions, if we can go to the places out there where we don't usually. So it's a question about of asking unusual questions and admitting to different ways of doing things that are not what we have learned from, you know, the systematic scientific methodology that tends to inform policies on a global scale. So perhaps a systematic review of what has never been written down. I don't know how that will happen, but it's doing research differently, because we want to look for information where we didn't think it existed.
That would make a great arts project, I think, if nothing else. Did you want to come in, particularly on involving indigenous groups?
Yes, thank you. I think it's very important what Judy is saying about look for the solutions, or look for the knowledge and different sources, especially from my work in the Amazon. So I was working with the Shawi and Shipibo indigenous peoples in Peru, And I learned that they are knowledge holders, right? So they have their own way to learn. And language is one of those sources of information. I mean, we write, right? We write and we have books, publications, and we have websites and everything. But the main way of communication among indigenous peoples is oral. When we were doing our work in Peru, and even I also conducted a 24-hour recall, for example, we struggle to see how we're going to do this in an oral way, in something that is really representative for these people, because the diet patterns in the Amazon is not the same that in the rest of Peru. It's not the same in the Andes. So it's very different. So, and language, that's one source of information. So in Peru, there are more than 40 different languages, and you can imagine how many languages are around the world in terms of how many indigenous different populations we have. Also, the biodiversity is also in that languages, in that way of life. So as you are saying, it's not necessarily that we look for the data on the databases that we already have. So we need to be more creative and see how we can work with other type of information, other types of knowledge. And also another example is that, for example, in research, we usually create pillars, right? So we have 4 pillars for this research, for this other grant proposal, 5 pillars. When we are working, or we have learned after many years, and we're still learning, even if I am from Peru, so it's for indigenous, or working with indigenous people, for indigenous people, is also involved about values, right? So indigenous people practice collectiveness, reciprocity, holistic view about health. So all these values, for example, are different ways to think about pillars. And we can think, for example, in reciprocity, when we are going to support, for example, a malaria program or a nutritional program, also they want to do something for us. They will teach us about how they live. So this reciprocity in terms of knowledge, for example, is another way of thinking and doing research.
Thank you. Let's move on to some of the Slido questions. And there's one that's come up that's been upvoted by a few people. What would you say is the one gap in the maps that you'd like science to focus on? If you could, maybe in the effort to start thinking towards doing a systematic review of the things that are not written, what should we send Alan off to map next that's not mapped? What's the thing we're not looking at yet? Look like you're ready.
Yeah, I'm happy to have a go at that. Yes, there are so many gaps, but I think for me what really stands out is the need for building leadership, research leadership. Now, my problem with leadership and research and science in general is it's so competitive, the metrics that measure it. And I understand competition is important in training. If you're training to be a high-altitude climber, you have to compete somehow. But when it comes to implementation and science that's addressing solutions, we need to do something about that competition, because the competition leaves people out who need to publish. Or if you need to focus on one thing that you're working on for a while and there's publish or perish over your head all the time. It also takes out a lot of creativity, because it's not always the best scientist who's the innovative one. And certainly that's something we've seen on our continent. The innovators are people who are living with a difficulty somewhere. Then they learn to build their own little battery at home so that they can have some light in the house, in the hut, to study for their exams. It really takes out the ability for people to innovate. But to make an important investment in really saying we need a different type of leader, the type of leader in science who takes others with them, and grows others. For any biological system, if you don't produce, then, your species, that's it. That kind of old professor needs to just be out of the system. I can say that because, perhaps I fit that bill as well in some respects. But we need to be able to open innovation, research, and ideas to the next generation and have that supported, not just in mind, but actively supported financially, so that we can deal with the issues that are happening for the next generation and that they need to prioritize in solving.
Anyone else got any notes on the maps? Or we can move on to another question. We've had another interesting question on the Slido about how English is, we're speaking in English here. English has come to dominate so much scientific discussion. I remember when I worked at Imperial College, we closed down our languages centre, but it was built on the principle that if you wanted to be a scientist, you probably needed to learn multiple languages. And they gradually realised that wasn't true anymore, and they could close them down. Would our diversity of thought and our inclusion work be improved if we could liberate science from English domination?
Shall I answer that in a different language?
Yeah, go on, yeah.
I asked if I could answer that in a different language than English, because I think we need to have a medium of communication, but I think there are also ways of looking for it, and what I said before about looking for information where it's not written down might also be part of that process, where we use indigenous, those who understand, speak both English or French or German and an indigenous language to be the mediators, so that information gets into the mainstream. Because what we're doing is not so much to create the diversity for the sake of diversity, but rather to create the diversity of methods that will help us to extract information from places where we don't usually look for it. Because we're looking for answers and to a crisis, the climate crisis. So let's bridge, let's go with people who speak multiple languages and who can help us then gather that information and learn from those who do not speak the mainstream languages, but who have a lot to teach us. So I think it'd be a question of the bilinguals in the working with the people in Peru and the Andes, and bringing us the knowledge that is sitting there that has not been published because it's in a language that's not the mainstream language.
And thank you, Adelheid, for that. I'd like to say something about language. Every child is able to learn 5 languages when they're born. And this is really, and in most countries, you learn your traditional language, you learn the language of the local language, and you learn another language in school. I speak 4 languages, but I never talk about the other 4 languages because nobody's interested in them. I do speak French, but I'm not such a good French speaker that I would stand here in Brussels and say I speak French. But there is ability for children from a young age to learn different languages. And I'm just raising this because there are issues of the curriculum. Curriculum in universities, even in schools that were designed in the 1960s, it's still the same curriculum. Medical schools, the climate curriculum is still the same. We need to do something about that. Otherwise, we have these issues in the pipeline. Teach other languages, except science should not have a language. I don't think that Stone Age woman who discovered fire spoke English. Or French, for that matter.
Anything else on languages? Or we've got another really interesting question taking us back to the link between science and policy, and saying that policymakers, they're impatient, they like immediate results. They want to know now. They want certainty now. And scientists don't like certainty and do not like to, it takes a long time to do stuff. Anyone got any thought about how we can ensure that there's a balance between, if you're having policy relevant research, we don't lose curiosity driven research and research that takes a bit longer?
Yeah, I think this is an important question, and of course you need a balance. But I think that the immediate results, I think there is a lot of research out there. There are lots of researchers and innovators already looking at providing solutions to some of the questions that we are addressing today. The problem is the connection and the bridging. So I think that although, of course, we need to continue funding basic research and funding more implementation research, we also need to do more in order to connect the different dots and to ensure that all these results that are already there or almost there are timely arriving to those who can build on them. And that, for me, is the difficult part of the equation. How to ensure that we can all communicate, this is like the personalized medicine concept, to communicate on the right thing at the right time with the right people. I think there are a lot of low-hanging fruits on which we could already act, but simply the dots are not bridged. So, I mean, and I think that's a little bit in the line of what was discussed yesterday, yeah? That it's not only about the English as a language, but it's also about the different languages of the different disciplines, and also a lot about communication. So all these things are essential in order to help us progress and act quickly. It's also to learn how to communicate and how to pass the right messages. I think that how to touch the audiences, all those things are very, very important in order to be impactful.
Thank you. I just want to add that I came from a quantitative training. So my first studies was in a master in control of infectious diseases, and then I studied a social science program in my PhD. So I think something that I learned is that we, as a researcher, we are very curious, right? So I am super curious about everything. Here in Brussels, I am really wondering about many things. So, but at the same time, when we are talking about climate change impacts in health, we need to also be active. So we cannot keep in the questions, but we also need to move out our comfort zone and go to talk with the policymakers. I think I've also been working in, for example, food security, and I knew the anemia was a problem and stunting was a problem in the Amazon, but the change is not going to happen if I don't work and talk with the people in the health sector, in the agricultural sector, in the educational sector. I think maybe in these proposals, we can include this advocacy action at the same time that the research when we are talking about climate change. It's not an easy thing. It's very, for myself, I prefer to be in the mountains and walking there, but it's really, yeah, because talking with people, especially with people in power, is complicated. It's not an easy thing. And also do it in a very simple language that they can understand and translate our results. We work for 3 years and having only one association, right? Significant association, yes or not. So how we're going to translate these to these policymakers, yeah, implies that we as researchers also need to learn these skills to move out our comfort zones.
Did you want to comment? Yeah.
Perhaps the policymakers could actually put to the scientists what they want to know. What do we need from the scientists in order for us to move forward on this policy? If the questions are coming from them, then the scientists realize, and especially if it's then supported with the means to go and do to feed their curiosity, I think it's important that the policymakers actually put the questions forward so that they are responded to by the scientists. And we create communities across those lines of policy and science by interesting one another in what the other side is doing. So I think it's possible to build the same way that we're trying to work from health to climate change to environment to social services, education. Policies and scientists, policymakers and scientists also can create those communities and, focus on what is common interest to both of them.
Yes, it's true. There's an awful lot of, the policymakers won't do this right, and the policymakers, or the scientists won't do this right, and all these misunderstandings could be helped by just having a chat first and working it out. And I will use that opportunity to do a plug and say that we have a call out at the moment through Wellcome on the health impacts of climate change. And what we ask for people who are applying to that call is that it's not just researchers working alone, but they involve someone who's going to use that research to inform the research agenda so that we can co-produce what those questions are, and that the researchers and whoever is going to use that research think together about how that research is going to be used. It's not the only way of doing research, but I think it does help, and it's one way of doing it. There was a question which picks up on one of the things that Judy was saying about competitiveness in science, asking, does anyone have any thoughts about how we could make science less competitive and more ethical, or ethical in other ways other than just competitive? Or someone want to speak up for competitiveness in science?
Okay, I can talk about the competitiveness, right, in science. And I think this is crucial because part of our training as a scientist is to actually get those grants, right? So we are like, and I see that from my experience working again with indigenous communities, we cannot follow that path intensively as should be, because, for example, in places like in the Amazon, as a physician, and even after social science and environmental science, we need, for example, how we're going to learn the language of the indigenous people to understand what is happening really there, right? So it's a different, it's not really a competition with the same story or the same research question and maybe the same scheme, so it's something different. So it's something first to understand the context before the competition, and also it's more ethically also because I will have more time to engage with the community and actually ask what they really want in terms of benefit. When we're applying this research, we actually, in our consent forms, right? We have compensation, benefits, and all the things. So I can separate and say, okay, this funding will be for the benefit, but I don't know what the community wants. So what is important in terms of climate change, for example, for the future. So I think we need a little bit of time to do the contextual research, maybe to understand this, what is actually what is the context and also what type of benefit will be for the community.
I could add something to that. Actually, it's an interesting question because it says, more ethical. And, most research protocols go through ethical review. So it's interesting that this question is being put as if there was no ethics in the process of science. Maybe what we could do is have the funders of research and the ethics review committees work together to ensure that science is not about competition and people trying to get a name, get a prize. It's really about doing something that is going to respond to the crisis. If you're funding research for a specific crisis, it needs to be, you can work into that process of approval, the ethical approval, but as well also the funding approval to see, is this actually addressing a crisis in a way that is not selfish? It is looking out for the good of people out there rather than that this is just for somebody to manage to make 10 research articles published in record time.
I don't know, but Adelheid, I think sometimes ethical review, it's important to have an ethical review of a research proposal. It's really important. But if you think about how ethical review boards are, they tend to stand there for a long time. Sometimes even the way they're constituted is not, it's not really based on anything that you can measure, I wasn't going to say they're not ethical, but it's just another way of spearing that competition. We have a situation where those who have published a lot and have received grants already are funded time and time and time again. There's no way that if you are the wild card, you'll be supported to do it. So it's looking at things like that. Publishing, everybody's dream is I must publish in Nature. So what am I going to do as an early career researcher working somewhere in a low LMIC to hope for this for 30 years and then finally get to a commentary in Nature? And that's a big deal. But you've done a whole lifetime of research. So looking at other publishing options, let's bring down the sort of disdain of open publishing. I think for low and middle income countries should go for open science, The reason why people don't share their data is because you've got to hold on to it because this is your only currency, I have research findings that I did when I was doing my early research that are on those, those floppy disk things. I can't even access those results anymore because there's no machine that would look. And everybody, don't laugh at me. I can see you're sitting here. You all have those things, written on papers in piles in the back of your office that we weren't able to share because there's nowhere to put that. It's your, this is just your currency to say who you are as a scientist. And those are the things that we need to address in competition, If some research is published well, and it's put as an annual report somewhere, there needs to be a way of grading that, of even doing a review to say that this is actually data. Because there are a lot of data that are in reports that groups of scientists have worked on together on behalf of CDC, Africa CDC, for example, WHO. You don't publish in Nature all the time at the WHO. So there's really just sit down and think about what is it about this competition that we must perpetuate it generation after generation.
Yeah, there's an interesting point about the ethics review, because our methods get taken to ethics review, but funders don't get taken to ethics review. So maybe I'm asking for a double that. So we should start to wind up because we need to get to the next session and let people move around. So I just wanted to invite each of the speakers just to say any summing up points that you had, anything you want to take with you, or you want the audience to take with them today. Can I start with you, Carmen?
Okay. So I just want to say that when you're thinking or working with indigenous knowledge, it's important that the scientists need to understand that behind the knowledge there are people, there are culture that have been done for centuries. And it's important that we treat this knowledge with respect and also be curious, but also use these values. I think thinking in these indigenous values about reciprocity, holistic, collectiveness, it's important to understand how approach and how to work with indigenous knowledge. Thank you.
And my bit would be about equitable partnerships. There are gaps. There are people living in that gaps. Can we work with them right at the start with the answering of those questions, or even surfacing the questions right through the whole, the whole value chain for designing research, delivering it, and funding it, and encouraging people to work together across disciplines.
Thank you. So indeed, I was going to say exactly the same thing about the importance that we keep this collaboration and we increase it, because we have seen that there are some stakeholders that should be added to the table. I would just like to reiterate our commitment and to again indicate that I hope that in the next maybe not 30 years, but just 10 years, we manage to to contribute and to have a different map, and that we have at least managed to change at least that aspect from our collaboration between the different actors, between the different funders, because actually it's so exciting to be discussing about all those things and to see that actually there are many opportunities. Because if you compare this area of research to other areas of research, you see that the opportunities are really there in order to maybe not give a solution to all the problems, but at least to already from the start some low-hanging fruits where the situation can be improved. So I am very positive and optimistic, as most of the speakers that have been in these different sessions already.
Yeah, and I could say that I think if we went away with the notion that in dealing with a global crisis, almost some people have described it as an existential crisis. This is the climate change and health. That I know something. What I know is a small piece of a larger whole, and I need to find the other pieces so that together we contribute to the solution that is going to address this huge problem, because it cannot be addressed by the health people, by the, I don't know, it cannot be addressed by one party. It needs to be, so we have a piece and we need to find the other pieces, the missing ones, so that we find the solution, because this crisis is huge. It's beyond any one sector, any one cultural group, any one geographical area. It's huge. So we need to find the others that will make the complete solution.
Thank you. And can everyone please join me in a big round of applause for this great panel? Sorry, I called you Carmen.